So let's look at it, how the CareScribe is different than any other AI notes writing software. First of all, let's open the CareCircle portal and we will reach to the CareScribe dashboard like this here. Now I've created a test profile and I've also created a test notes. Now this note is basically a COE and the composite restoration that we did in the same patient. Obviously I've given the name as it, and this is just a trial to show you how this is super awesome way to write the notes. Now the advantage of having a CareScribe is it gives two main things that is difficult to find in any other competitor. Number one is legal risk flags. Now it will analyze your notes and then it will tell you, hey, you know what, there are some cases that has happened in the past and some of the information that we have missing in these notes are the reason for those any kind of fine against the dentist. So those are the areas. Let's look at one by one. It says the COE note does not document the patient's specific medical history or medications. Now, next is the consent. The composite restoration note only mentions about the verbal consent without specifying the risk, benefit, and the alternative discussed. Now, we have to write those sentences. What are the risk, benefits, and the alternative, whether that was discussed or not. That will allow you to take the proper consent. So that was missing from my notes. So yeah, it gives the flags here. Now also the diagnoses were missing. We have prescribed a night guard, but we haven't mentioned anything about there was suspected grinding and there is a attrition in the objective finding. So we cannot justify our treatment proposal of night guard. That is a red flag here. Now next thing is the billing. The composite restoration note lacks the documentation of pre-operative findings for the tooth number 24, which could lead to the billing disputes or the audit concern. Yes, we have to write down what is the existing condition about the tooth. So that will help when we submit our notes to the insurance company when they request for the audit. Next is the COE note does not document the patient's satisfaction with the smile and the functions. Yeah, even a small sentences we forget to write in the notes that can affect in the long run. So that's the legal risk. Now the next one is the compliance scoring system. So with the compliance, it checks whether your notes is meeting the guidelines set by the regulators. Now we know that there was a medical history was missing and there was some diagnosis test results were missing. The periodontal finding is missing in the objective findings. Next is the pulpal status and the perio risk assessment. That was missing. Plan. In the plan, it says anesthesia details, prescriptions, and the referrals. The anesthesia, yeah, look at this. It's like a template. That was not right. So we need to correct this. And then the insurance tips. Like, you have to write a proper wordings and the verbiage. Carious lesion extending into the dentin instead of decay. So yeah, and if you want to make some changes, you can just click this, update with the voice. And okay, so now add the proper medical history, which is we asked the patient about any recent changes in the health. Patient declined and there was no contraindication for the today's treatment. We also checked about the overall perio assessment. My hygienist did the perio probing and then patient is aware of there is a mild to moderate deep pockets, but the patient can maintain the oral hygiene. Patient is using the floss and the water floss, and patient is aware of there is a mild gingival recession generalized, and we use only one carpil of lidocaine 1:100K epinephrine buccal infiltration of the 2-4, and yeah, change the wording from decay to the carious lesion extending into the dentin wherever you see it. We also did one more periopical x-ray for the tooth number 1617 as there was a history of root canal treatment and patient is aware of there is a deep pocket and a patient can able to maintain it. There was no sign of gingival inflammation at this point. So yeah, now once we have those information here, what we can do, we can let it pop up. Yeah, it does take some time and it's right here, but there's a good button, regenerate. Once we click this regenerate, it will spread the notes and the content into that respective sections of the notes. Okay, so now the notes have been completed, no significant finding, and yeah, that's it.